I'm Dr. Jennifer Mercier. I'm from a suburb outside of Chicago, Illinois, and I'm the creator and founder of Mercier Therapy Professional Training and Mercier Therapy. Not only is Mercier Therapy used for women with fertility challenges, but I'm also using it and teaching it for women that are dealing with gynecological issues, such as common pathologies like endometriosis, polycystic ovarian syndrome, women that have recovered from pelvic infection or surgery. And what happens with any of those pathologies or recovery from surgery is that our body naturally forms scar tissue in an effort to heal itself. And scar tissue can be very invasive. Scar tissue has the ability to glue everything down or together and not allow the organs to function as optimally as they could as independent organs. Recovery from a C-section. The lower anterior segment of the uterus is incised to remove the baby. Once that uterus is put back into the pelvic cavity, it then is laying directly against the bladder, the posterior aspect of the bladder. So what's happening then is the scar tissue is forming on the uterus as it heals, and that starts to adhere to the bladder. So many women that have had C-sections will complain of bladder issues, incontinence, pain, pelvic pain in general, things like this occur all the time, especially when we have a C-section rate of 40%. Women do need to have therapy to rebuild and restore their pelvic organs, especially for future pregnancies. I see a lot of secondary fertility challenges due to primary C-sections because the organ is so adherent to its surrounding structures that the blood flow is literally not as good as it could be. So I start to see women recovering from C-section at approximately 6 weeks if there's no gaping in the scar or infection present. Women that are recovering from hysterectomy. So I've come up with organ displacement, and it's actually a theory of mine. When you remove an organ, there's got to be some other organ that falls into its place or some other structure that moves into that space where that organ has been removed. So hysterectomy is removing the uterus or uterus and ovaries. And a complete hysterectomy leaves a lot of space. So the bladder kind of flops backwards. It leaves a lot of space, leaving that bladder a lot of space behind. When you remove the uterus, there's quite a bit of space behind the bladder, so the bladder is allowed to drop backwards. It can cause urinary incontinence and prolapse because there's nothing suspending that bladder any longer. So then you've got to get in there, and we use Mercier Therapy to bring the bladder back up into the pelvis. Any recovery from surgery, pelvic or otherwise, there's going to be scar tissue that needs to be worked on. It's very important work just to restore everything and get it back to its proper working function. Because after surgery, that scar tissue is going to create a new normal position for the organ. And that isn't necessarily the normal for your body.